Well, a lot of people struggle with their weight and many turn to HCG. It is making a big difference. This morning, Dr. Tom Rogers, our daytime doc, introduces us to one of his patients that is using this method and having great success.
Thank you. It's great to be here today. I've got a great guest here, a patient of mine, Steve, and he's got an interesting case. Steve came to me about 4 months ago, overweight, on a ton of medications, and didn't know what to do. He'd been told by friends and family and doctors, how do I lose this weight? And what most people don't realize is that you have a metabolic disease or problem of insulin resistance. So you've got to do something besides just eat less and exercise more, because that doesn't work. When I know you found me kind of through, internet or other people, but tell me kind of your interactions with me in the last 4 months and how you've done. Obviously you've lost, I think, 84 pounds in the last 4 months, but tell me kind of your story.
Yes, so about 6 years ago I was diagnosed with rheumatoid arthritis, and so I've struggled with my weight all my life, but the last 6 years it's been really hard to be able to get that weight off because I can't exercise like I used to, and I'm not moving like I used to. So I've really struggled. A lot of my doctors, friends, family said, try the surgery. You'd be very successful to get the weight off that way. The surgery really scares me just because it is a major surgery. I've known people that's had it, some have been successful, some have not. The cost out of pocket's very expensive. And I've seen you online, I've seen you in stories and articles, and I knew you did a lot of HCG Diet. So I did a lot of studying before I came to you, just to kind of find out what is it, how does it work. And so I thought it was the right idea. So when I came in and met with you, you gave me everything that I knew about the diet plus more. And you gave me even more information than any of my doctors had ever gave me, that I'm insulin resistant, that I've got some metabolic issues. So the diet's tough. It's a hard diet. 500 calories is hard. But after I got through the first week, it was great. The staff, you have been great here. And I've actually done the diet twice, and that's how I've lost so much weight. And I'm getting closer and closer to my goal weight.
How has your rheumatoid arthritis done? Has it generally felt better?
While I'm on the diet, it definitely feels better, and I have had improvements. I think I feel better with the weight loss. 80-some pounds is a lot of weight to lose, so I think that's made improvements on the joints and so forth.
I do like HCG. I don't cut the surgery down. Some people need it. I send some people for surgeries. I prefer to try an alternative way like HCG, which is very safe if done in the hands of somebody that uses the real stuff and knows what to do. But with Steve, I got a Boston Heart panel, and I found out that he was very insulin resistant. At some point we're probably going to transition him into a medication called Victoza to help him overcome his insulin resistance and craving carbs, which is what most people do. It also gives me testosterone levels and everything else, how inflamed your body is. But it's good for people to see somebody like you who has a metabolic problem that can overcome this. I mean, I can absolutely tell you for sure that we'll be sitting here a year from now, you're going to be another probably 80 pounds lighter than you are now. But you have to kind of change a lot of things up, and you have to have guidance in how to deal with this metabolic syndrome. It's great to have you on the show today. I hope a lot of people get benefits from this. If you have any questions or problems, contact me at performancemedicine.net.
The preceding portion of Daytime was sponsored by